In this video, I answer a question from a massage therapist about why I don't do full body treatments and why shorter session times are more effective for clients with chronic pain and injuries. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long lasting pain relief. I'm also the creator of the Peak Method, where we teach massage therapists a new treatment system that eliminates the frustrations of inconsistent results and produces long lasting pain relief for their clients, all while working 50% less. All right, so this week's question came from a massage therapist in Georgia. The question was, I do appreciate the content you share about helping those with injuries and chronic pain. I have noticed that you are a big advocate for shorter treatment times and focusing on specific areas instead of doing full body work. If you know what you do does help, why wouldn't you want to do a longer session and treat the whole body to get even better results? Thanks so much for sending that question in. And actually, also, just thank you for being nice about the question and asking genuinely instead of, being a jerk and telling me that I suck, which you get a lot of that on the internet. We need more of this. Just good banter and good conversation going back and forth where we don't have to feel like we're like going at each other. And if you watching this have any questions you want me to answer, just drop them in the comment section below or email them directly to me. Links for that are in the profile or wherever you're watching this video. I always want to share context when I'm talking about things. I'm sharing my experiences in what I do, which is chronic pain treatment and injury treatments, which is where my perspectives always come from. I'm completely fine if you do traditional massage work and relaxation. I think there's a huge need for that, but in my opinion, in my expertise, I don't think it's going to help fix a chronic injury long term. So there's a few topics that I want to address and concepts that I want to talk about in this question to help give some better insights and understanding. First is just recognizing all the components in the chronic pain presentation. We make this mistake a lot, especially as soft tissue providers. We think everything's like just the soft tissue, maybe the fascia and stuff like that. But there can also be bone problems, cartilage problems, disc problems, ligament problems, nerve entrapments, and tendons. And we really need to recognize all of them and understand in a chronic pain presentation. When I'm talking about chronic pain, I usually say someone that's been in pain for at least 6 months. The degeneration component of that is a huge factor as well. And degeneration, you're usually going to see that in the bone, the cartilage, the discs, and the tendons like that as well. Next concept is just getting the treatment dosage correct. I made this mistake for years, and I still see a lot of other providers doing this as well. They think that treatment can only make it better or do nothing. They never consider that it can actually make the problem a heck of a lot worse, which is why I don't do those longer treatment times. I always say treatment is like a medication. We can do enough to be effective, but we can actually give too much and make the problem a heck of a lot worse. Especially in those clients that are presenting with some of that degeneration as well in the bone, cartilage, disc, or tendon, we can actually overdo it and do more harm than good. The analogy I always think about, and I share this with my own clients themselves, because they also are like, hey, I'm only here for 20 minutes. Why can't you do 60? Why can't we get more done? I say, think of your injury and your pain as like an infection that needs an antibiotic, and the doctor gives you a series of antibiotics over 10 days. You don't take all 10 on the first day. You spread it out to give the treatment a chance to be effective without overdosing it. Next concept is just start regionally to eventually going more globally. I remember this was like last year, and I had this lady. She was not very nice. It wasn't her fault. She just been, lied over and screwed over by the medical system and hadn't got a lot of answers and spent a lot of money and was just really jaded by the time she came in and just wanted to be mad at me. She kept going. She had this really bad neck problem. She kept going to all these different providers, and they didn't start by treating the neck. They started focusing like, oh, your foot and ankle aren't moving correctly, or it's a pelvic floor dysfunction, and compensating. And they weren't ever really treating her area of complaint, which is her neck, and convincing her that it all came from this other stuff. And yeah, I agree. It probably did cause a lot of the issues and imbalances, especially when a client presents with no direct trauma, that's probably what did cause it. Something in the chain didn't work, but we got to start in the neck to get that tissue healthy first, then make our way down the chain. So I do eventually do whole body work, but I start in the complaint area first. We start here, say it's a neck problem, we'll start in the neck, then we'll look at the shoulder, we'll look at the mid back, and then eventually lower back, hip, and we'll go down until we get rid of all of it. But if we try to go way out in the periphery and not address here, this is going to continue to get worse and continue to be a problem. So we got to fix that first. Last concept is just better client compliance. Here's the thing: you can sell to them, and I think selling is great when you actually have something that can make someone's life better, improve their overall quality of life. You have a duty to sell your butt off and get them into that solution, and they can commit to that solution. And then it's actually easier for them to come in for shorter visits as opposed to a longer session. A lot of people might not be able to find an hour, 90 minutes, 2 hours to come in, but if you could see them twice a week at 20 to 30 minutes, get them in and out, they're going to be way more likely to stick the process through and see it all the way through, because there's a lot of people out there that don't have a lot of time and they tend to have like more discretionary money to pay for treatments and stuff like that, and they want a shorter session, especially if it's going to fix them. It's also going to allow you to always focus on improving function for the client, not just symptoms, and feeling like you have to hit a home run on one visit. And maybe the client feels better, maybe they don't, and then they kind of wash out. This allows you to have a whole process. Next thing is the client just isn't as beat up in between visits and has a better view of the whole process, and they do see it all the way through. And the best bonus of all is it's way less wear and tear on you as the provider. So yeah, I do eventually do full body treatments, but I want to spread it out, especially in the chronic pain side of things, because we want to accommodate and be attentive to all the factors. So that's all I got in the video. If you're frustrated with not getting consistent results for your clients who are injured and in pain, maybe you're on the verge of burnout and you feel like you're just stuck going through the motions in practice, maybe you're ready to try something new that eliminates the frustrations of not getting consistent results and allows you to cut your treatment times by 50%, then click the link in the description box below to get access to our advanced shoulder training course and also get 4 CE credits for free with no strings attached. Information is wherever you're consuming this. I appreciate you watching the video, and I'll catch you on the next one. Bye.